you very much. I'm very excited to be here and to be part of this project about post-Fukushima studies. I'm sorry if my presentation is going to be a bit tight, maybe, compared to Ure-sensei one, but I'll try my best to be clear. So, as said, I'm a first-year PhD candidate at Tohoku University, and my research currently investigates the medical controversy surrounding cases of child thyroid cancer in post-disaster Fukushima. I will first provide some background as regards to the epidemiological assessment and the medical checkups which are carried out in the prefecture by the Fukushima Medical University. And next, I'll expose my research questions and explain their relevance. So, as you can see, my general objectives are to report in what ways the government's health risk assessment has become a contested matter, and to look into how the thyroid cancer diagnosis and treatment might affect these patients and their families' lives as regard to their well-being and their broader socialization. So first, a backdrop about low-intensity radiation health risk. These might be a bit pedantic considering this specialized audience, but of course, there's the need to say that low-intensity radioactive exposure itself is not considered nor a sufficient nor a necessary cause in developing cancer. So at present, it's impossible to scientifically prove without a doubt a causal link between the nuclear accident and these diagnoses. Nevertheless, talking about the practice at Fukushima Medical University, the diagnosis emerged as the result of protocol mandated by the Japanese Ministry of Health since July 2011. The target of this protocol were individuals born in the Fukushima prefectures and between 0 and 18 years of age at the time of the accident. And so now the collected data are part of this Fukushima Health Management Survey, which has been carried out by the Fukushima Medical University. The 5th round of results has just been published and accounts for a total number of 333 diagnoses. And these figures can be interpreted as showing a 20 to 40 times higher cancer incidence rate in terms of thyroid cancer, of course, among these children compared to the general population in Japan. So I'm going to explain in a moment how these data can be differently read. But first, I wanted to point out that what this means for the patients is that most part of them have already been treated surgically with a partial or total removal of the thyroid, a surgery that is quite impactful and commits them to a lifelong substitutive hormonal therapy. So the extreme uncertainty regarding this possible link between these emerging diagnoses and the nuclear accident has catalyzed a quarrel between two sides. One is prefectural health authorities represented by the specialists working in Fukushima Medical University. And when I say independent researchers, I mean STS studies specialists and commentators, but also oncologists, epidemiologists, and radiologists from University of Okayama, mainly. So the former imply that these figures are due to the systematic application of advanced diagnostic tools in the monitoring. I'm sure you've heard about this expression, screening effect, that compares to a form of overdiagnosis. In other words, the more you look for a disease, the more cases you will find at the stage when the disease is not clinically apparent. And it's difficult also to tell whether it would have become symptomatic at a certain point. What the independent researchers point out is that the official communication about radioactive risk has been dismissive mostly, and so as often used rhetorically dismissive arguments, but also scientifically questionable arguments that I'm going to quickly address. Unfortunately, I don't have the time to make a whole list, but basically a couple of these tend to undermine the theory of the overdiagnosis. So this is the first part of my research, which would like to give an account of this criticism. So comparing sources. The first criticism is that there has been a frantic pattern of evacuation after the disaster that makes a statistical model based on broad population groups less effective in predicting the individual health risk of someone, which has been attributed to that category. And this has to do with the lack of data regarding specifically internal exposure immediately after the accident, because those data were impossible to collect in the chaotic aftermath of the earthquake and the tsunami, and are now impossible to retrieve. I just want to focus for a second on the concept of internal exposure, even though I know that most of you know what I'm talking about. But of course, it refers to isotopes entering the body through inhalation and ingestion. And what we're focusing on mostly when we talk about the pathogenesis of thyroid cancer is iodine 131, because that is universally acknowledged as a prominent factor in thyroid cancer pathogenesis. At the same time, it has a very short effective half-life, only 8 days, and so has mostly gone undetected, as said, because the distribution of the pollutants after the radioactive fallout was investigated slowly by the national institution, and so the evacuation policies couldn't be based on reliable data to this regard. That's why it is thought to be possible that part of the population experienced a much higher exposure than estimated by the survey. This is the epidemiological backdrop, and I will now go on and expose my research questions. First, I need to make a disclaimer about my ethnographic targets. So first ethnographic target, of course, are the child protection associations born in these last 11 years to support the patients and their families. Ideally, I would be talking also to the patients and parents, especially the mothers, since, as many have pointed out, that women are the most inclined to take charge of these initiatives in Fukushima after the accident. However, the problem is that in this specific case study, talking directly to the stakeholders, the patients, might prove difficult, because for reasons that have to do with the management of their medical information, they are rarely in contact with each other, and are also generally afraid of publicity for reasons that will become apparent in a moment. But in a nutshell, my most accessible interlocutors right now are the association's representatives. So at present, what they do is to challenge the epidemiological assessment provided by the Fukushima Health Management Survey using other critical sources, scientific sources, and to provide services of radiation monitoring and health checkups for residents, but also to provide a safe environment for these concerned parents and youth to discuss their anxieties linked to their everyday experience and their disease. So my research would like to contribute to the debate around the social impact of the Fukushima nuclear accident, not only by recording this controversy going on around the epidemiological assessment, but also investigating how the public communication of health risk and the clinical practice at the Fukushima Medical University are interlinked, and how both influence these patients' social identity. My first question could easily be, how do thyroid cancer patients and their families experience this medical protocol? Well, research addressing the subject of cancer in Japan are still extremely rare. And the reason might be, as someone important like Onuki Ternei in the 80s pointed out, that in Japan, negotiations over cancer treatment often fail to involve the patients in the way we're used to think of a therapeutic alliance in oncology in Western countries. And so reports from the association aligns to this and say that similarly, the medical consultations going on in Fukushima Medical University are very directive regarding the way the diagnosis is delivered to the families and regarding the way the treatment options are presented. So following the associations, the current practice risks affecting these patients' recovery in what is commonly referred to as iatrogenic potential, psychosocial iatrogenic potential in this case. While we know that a more communicative approach would be beneficial to patients' well-being and possibility to help them making sense of their suffering, these do not seem to be happening in Fukushima. And so that's why the associations are trying to subvert this strictly top-down protocol and question the therapeutic choices and set up a ground-level psychological support network. And I find that this is a form of community medicine that is extremely worth investigating in current Japan in general. And so the second question, I'm sure many of you made the connection with another historical case of radiation sickness in Japan, which is the one of the victims of the bombing of Hiroshima and Nagasaki. This is a precedent relevant also because these victims were under a special medical attention, but also were socially ostracized due to the widespread belief that depicted them as prone to illness and reproductive health problems. Here, the concept of biosociality helps. And so, said very simply, these concepts can be used to address how social agents rethink and reshape their identities when confronted with biologizing discourses as the one of a medical institution. So the associations in Fukushima claim that similar episodes of discrimination are taking place today. So what is important to investigate is to which extent the personal experience of these thyroid cancer patients and their families bear similarities to historic hibakusas, and also to look into whether and how the child protection associations supporting them try to leverage these discrimination claims politically as a form of biological citizenship. And there is a good case study I would like to focus on in my studies. I'll try to make contact with this group and proceed in doing in-depth interviews. But you might have heard that last November, 6 Fukushima cancer patients have sued TEPCO for damages. And the association supporting them, called Saneichichi Kodomo Kodo Sengan Taiban, is particularly into these claim of discrimination going on against the patients. And in fact, the plaintiffs report that the diagnosis wrecked their life, and that to the anxiety of the illness adds a fear of being discriminated at school, on the job market, and also with marital prospects. So it is important to address, I think, whether a notion of post-Fukushima radiation sickness is emerging, and how, through the associations, these might be linked to the historical precedent of Fukushima Nagasaki's case. So probably it was, again, very tight, but this is the conclusion, meaning that I want to report the scientific controversy born around the official epidemiological assessment, but also focusing on the more anthropological part of my research. I'd like to illuminate how these patients' associations are making medical knowledge more accessible to citizens, and supporting them economically and psychologically in connecting cases of thyroid cancer in Fukushima to Hiroshima and Nagasaki hibakusha to gain better visibility from political institutions. And finally, also to investigate the everyday situation of these children undergoing medical treatment, so to see how their social identities have been shaped by the relationship with health providers. So while I verify this visibility, I will try to collect secondhand ethnographic data from the associations. Hopefully, I will get in touch also with the patients and families. So that's it. Thank you.
Thank you very much, Chiara. We have time for some questions. Maybe I have a question. You showed a map. I understand that to have information about the spatial distribution of iodine is challenging, but you showed a map, and it was quick, and I'm not sure what's really.
It's a map available on the website, actually, of the Ministry of Environment. It was mostly to how can I say, introduce visually to the idea of.
No, but I was curious to know
if not specifically about the Yodan, is more of external exposure in this case. Yes.
Can I continue on that question? Because one very important thing you're making is that there was lack in the very first weeks of radiation following exposure. Is there any kind of proxy that we could use to try to assess what was the exposure to iodine, given the other radio elements that we find? And
there has been attempts to this regard, but in this case, the problem is that there are also sources that has to do with the water availability and with food consumption. And it's not always easy through questionnaires to access those data. So talking directly to people after the accident would have been crucial in that case, just to understand exactly how they accessed food and water, where they were exactly. All these information are very articulated and so quite complicated to access right now. And the problem is that measurements were impossible to do because the total, the whole body counters machines, the few available in Japan, well, once on site were contaminated themselves, so not usable. And others, of course, were not on site, so it was impossible to physically measure the total exposure in the bodies of the evacuated people at the time. Yes, it's a very thorny. So we can rely on estimates, but again, this becomes a political matter once more.